Financial incentives that exist from a variety of our partners, from the federal government, from CMS, Medicare, and Medicaid, to New York State, to even some of the insurance carriers which have programs to help providers earn a little bit more money for using health information technology. So what this includes is patient-centered medical home, assisting accountable care organizations. Out of curiosity, you want to hear a member of an accountable care organization? Yeah, there's a lot more accountable care organization presence in the other boroughs. PQRS, as well as the payer incentive payments that exist from some of the Medicaid managed care plans. And additionally, we'll be starting to host a program for the transition for ICD-10. Now, some of you have taken advantage of our billing and coding training. We've hosted that historically at 80 Center Street downtown. But we have our billing and coding professionals here. If you could give a wave in the back corner there, we'll be hosting a table in the corner here to answer some of your preliminary questions. But we have a whole series of programs to train not only providers on how to appropriately bill and code, but also your front office staff, also your back office staff, to make sure that you're getting everything that you deserve, and also are aware of the ability to bill and code in a manner that actually will incentivize you to provide a broader scope of quality of care. So we have a number of new programs we're excited about. We're helping providers not only in the primary care industry, but also specialists and behavioral health providers involved in electronic health records, and to work through all of these various programs. We're looking forward to partnering with the community, and we're looking forward to developing relationships with those key stakeholders here in Staten Island that providers like yourselves and practices like yourselves recognize as being the thought leaders. And so we certainly welcome all of you to be able to give us insight and give us a sense of what directions we need to be going in to really be able to meet the needs of this community. Now, we're fortunate as the health department to have a ton of information on the status of care here in Staten Island. We get to see things like smoking cessation rates. We host the diabetes patient registry. But at the end of the day, it's that relationship with the practice that really makes a difference. And that's what we're here today to continue to develop, is our relationship with each and every one of you, so we can understand what are the struggles, what are the challenges that you're facing, and what are the programs that we need to put together in order to be able to meet them. So I cannot thank you enough for joining us this morning. I'm certainly excited to get a chance to actually meet some of you in person who I've not had a chance to speak with before. We have a number of tables from our program describing many of the aspects from patient engagement to the ins and outs of meaningful use to general questions like how exactly should I go about selecting an electronic health record? And I'll have a chance to go through each of those with you in a moment. But first, I want to introduce Lauren Corboy. Lauren is our outreach specialist here for Staten Island. For those of you who aren't in our program and are interested in taking advantage of it, Lauren is your main point of contact, and she'll describe what all of those steps are. So thank you.
Making some trips out here from Manhattan, which is really exciting. What I want to do this morning is just kind of briefly explain to you what PCIP and NYC Reach are, what we do, how we can help you, and kind of why we're all here. So NYC Reach is the organization that we all work for, and NYC Reach is housed within the Primary Care Information Project at the Department of Health. PCIP was started in 2005 by Mayor Bloomberg with the vision or the goal of maximizing health and outcomes through health information technology, specifically in medically underserved communities. And so the way that we started doing that, as Brett mentioned, was by giving out subsidies for electronic health records, specifically EquinoCords. We did that for a couple of years and helped 3,200 providers with hardware and software and really getting started with the process. And what that meant was that we touched 3 million patient lives, which was really exciting. So those subsidies are over now, but now what we're doing is helping providers with the Meaningful Use Incentive Program. And we are now helping 9,000 providers over the 5 boroughs. And we help small practices, large practices, outpatient clinics, community health centers, and hospitals. So we really have a huge footprint all throughout the city. And our vision at PCIP is healthcare that maximizes health. So the way that we choose to approach that is a 3-pronged approach. We use EHRs oriented towards prevention, and we combine that with practice management and population management workflows. And then that's when you really see payments that start to support prevention and chronic disease management. So those 3 prongs are really the way that we choose to tackle our vision in trying to improve health in New York City. We have 5 main pillars that we focus on at PCIP. The first and primary one, and the reason you guys are all here today, is EHR adoption and meaningful use. So the way that we do that is through regional extension centers, or RECs. Brent mentioned that there are 62 RECs throughout the country. NYC Reach is the regional extension center for New York City, and there's one for New York State as well. Quality improvement and pay for quality is the next pillar that we focus on. You can see that through initiatives like e-prescribing, patient-centered medical home, which Brent mentioned a little bit, pay for performance, and billing and coding initiatives. And again, as Brent mentioned, we've got the billing and coding people here today. You can ask them all sorts of questions about how we focus on that at PCIP. Interoperability is obviously another huge issue with health information technology in general. So health information exchanges and interfaces, we do a lot of work with lab interfaces at PCIP. So we're really focusing on the interoperability piece and trying to make all these EHR systems be able to talk to each other and really make a difference. Public health monitoring, obviously the New York City Department of Health has always been the body that has focused on public health monitoring, and now we're just kind of evolving in that role as we see health information technology really kind of taking over healthcare in this country. So we're kind of adapting to that in that role. And lastly, chronic disease management. We recently merged with the Bureau of Chronic Disease Management, so we're starting to see a lot of really exciting initiatives in diabetes management, cancer screening and preventive treatments, and cardiovascular disease. So why did this all come about? Why are we even sitting here? Why does NYC Reach even exist? So with just a little bit of history for you guys, pre-2009, we had a system, obviously that was mostly paper records, unless you're Dr. Volpe, you probably weren't using an EHR yet. And that was really a system that was kind of under-equipped to meet the needs of our rapidly changing medical system. So in 2009, there were $20 billion that were allocated to fund an EHR incentive program and to fund the 62 regional extension centers that I mentioned. So that's where the funding for NYC Reach comes from, just a little bit of background for you guys. And the goal of this was to, by 2014, have widespread adoption of electronic health records and meaningful use of those records. So clock is ticking, we're almost in 2014, and we've already seen huge differences in rates of adoption and the meaningful use of electronic health records. So if you're not familiar with what meaningful use means, luckily we have a table. I'm not sure which one it is, but we've got a table that is devoted solely to meaningful use overview, and you can really get a step-by-step guide on that. So that's just a basic background of PCIP. I don't want to go into too much detail because, as Brett said, we've got tables here that can really answer any question you could possibly have about PCIP, NYC Reach, and meaningful use in general. What I want to do now is introduce our provider, who will be talking about his experiences with electronic health record adoption, patient engagement, and NYC Reach. Dr. Sal Volpe, I'm sure a lot of you guys know, is a primary care provider here on Staten Island. He's board certified in a whole bunch of stuff: pediatrics, quality assurance, internal medicine, and geriatrics. He's the co-chairman of the New York State Medical Society HIT Committee, as well as the co-chairman of the Richmond County Medical Society HIT Committee. And most importantly, we think he is a consultant for us. Has been hugely helpful. In 2010, the Health Information and Management Systems and Society, or HIMSS, recognized him as the chapter leader of the year. In 2011, SUNY Downstate Medical School gave him the Geriatrics Medicine Award. Most importantly, for our purposes today, in 2012, Sal's practice was the first practice in the United States to achieve NCQA PCMH Level 3 designation, which is really a huge deal. So I kind of want to give him a round of applause for that right now. In 2012, he was also named the Chief Medical Officer for the Physician Desk Reference Company, or PDR. And Dr. Volpe has been using an EHR and a patient portal at his practice for 10 years, which is really, really amazing. Since we're just now seeing a huge push for EHR use, the fact that he was so ahead of the curve is really super impressive, and we're just so lucky to have him as someone that's been on our side for a really long time. So I would like to now let Dr. Volpe come up and kind of give his perspective on everything.
Starting their day with us and breakfast at the Excelsior Grand. How many people here do not have electronic health records in their offices? Well, you cannot imagine how different the world is in just 8 to 10 years. I've been in practice for 20 years, and I've just seen how practice has changed both in how we treat disease, but also how we run the business of medicine. I've seen how computers have gone from these big boxes that would fit underneath our tabletops to literally these handheld computers now. These are all handheld computers. They call them cell phones because that's how they sell, because no one likes to buy computers. But handheld computers in your hands that you share all your personal stuff with, the treasured moments with your friends and family, but also the ability to check labs, interact with your patients in a nice, safe way, the ability to interact with your peers, all in a device that fits in your pocket. A lot has changed in these years, and even though I'm kind of halfway through my career, it's been amazing to see so much occur. About 10 years ago, I was able to convince my wife to let's max out all the credit cards, because 10 years ago, we didn't have PCIP, we didn't have New York City Reach, we didn't have meaningful use, we didn't have a lot of things. But we did have a couple of pieces of plastic. And so we maxed out to $30,000. $30,000 because we had, yeah, you're right, you should be surprised, it's crazy money. $30,000 so that we could afford the software, the hardware, and the training. And back then, we could only afford 4 days worth of training, because that's all that was in the budget. But fortunately, between having a very dedicated staff, an incredibly understanding wife, and the 2 very fine boys that are sitting at the first table, we were able to get through the hump, because the first few weeks and months are hard. I'm not going to lie to you. I mean, even geeks like me have to admit that there's a learning curve. There's a transition. Any change is difficult. Hopefully the change is for the better. And I think it was, because even though we had to invest $30,000 of our own money into this, at the end of the year, this is almost 10 years ago now, at the end of the year we started seeing savings. The savings were, coincidentally, $30,000 a year. And those savings came because we just became so much more efficient. We didn't need to have a staff person sitting by the phones waiting for a patient calling for a refill, for an appointment, for a referral to Dr. Raj and all the other good doctors here. A lot of that stuff is now handled through the internet for us. It's a lot of self-serve, just like when you buy your airline tickets and book a cruise. The patients are working through the system to take care of themselves. That means we didn't need staff to do that. We didn't need to spend money making paper charts. We didn't need an 8x10 room to store a practice that was almost 20 years old at this point. So when you look at the savings, it makes sense. Every other industry's moved in that direction. We moved in that direction. And now the benefit is we've got all this assistance. We've got federal assistance. Is there anyone here who takes Medicaid? Good. A good number of you participate in Medicaid. Well, for those of you who participate in Medicaid and also have a patient-centered medical home, there is some significant increases in reimbursement for practices that are PCMH level 3, as well as participating in Medicaid. Enough that it more than covers the cost of the implementation and the ongoing cost, because there is an ongoing cost. Once you become a patient-centered medical home, it's a significant move from the urgent care model, where people come in for their sore throats and then they go out. And then maybe they come in and you're monitoring their blood pressure. With the electronic health records, it's important to take care of most of the patients who don't even call you. There's this concept of the tip of the iceberg. So if you know how icebergs work, any of us were on the Titanic, you realize that most of the iceberg is below the waterline. Most of the people who really need intervention, the diabetics, the people with hypertension, coronary artery disease, many of them are not coming into our offices. Electronic health records and the systems attached to them help us do that. 6 years ago, I was very lucky to join PCIP New York City Reach. And as Lauren told you, thousands of doctors were helped. And coincidentally, connected with those thousands of doctors were millions of lives. And there are published statistics that show diabetes management, hypertension management, lipid management significantly improved. It's still pretty early, because it's only like 6 years old, the program. But I am sure when you look at the 10 and 15-year mark, you're going to see decreased admissions for people needing bypass surgery, needing to get amputations for their diabetes, and etc. A lot has happened. Just as our practice has become electronic, I think our patients have become electronic. When I got involved again over a decade ago with e-prescribing, it was a great way to grow our practice, because my patients would literally be telling their friends at church or at mosque or at temple, you know what, I got this Dr. Volpe, and when I need a prescription, I go to the office, he sends it magically through the internet or something, and when I get to the pharmacy, I don't have to wait. How many pediatricians in the audience? Come on, raise your hand, I know you're a pediatrician. Very good. So you could just imagine mom with 3 to 4 kids picking up paper scripts from your office and then having to go to the pharmacy and be told that she has to wait 20 to 30 minutes to pick up her script and then have to figure out what she's going to do with 2 to 4 kids before the script is ready. Well, it was very helpful to her to have those scripts waiting for her. So what we did was, by introducing the EHR, we also introduced the concept of the patient portal. Patient portal was a way for us to communicate with the patients, like I said, making their appointments, but they also have access to their labs. So as soon as I review a lab and I say, okay, to send, my patients are reviewing their labs at home. And the initial thought from a lot of physicians in the very beginning was, oh my God, I will never get any rest. I'm going to get 10 million phone calls from patients who are looking at abnormal BUN creatinine ratios. That's a horror. That BUN creatinine ratio, it's scary stuff. But, so I've been able to reassure them that, one, I put a little comment about what's abnormal, what's not abnormal. We give them a link to a site called Lab Tests Online, which is a great, again, self-serve. They want to look up BUN creatinine ratios and MPVs and MCVs. It's there in a nice, easy to understand language. The more you educate your patients, the better it is for them, the better it is for you, the less likely you're going to get the frantic phone calls. You build up this trust. And that's what was key for us, the trust, that if they did need to contact me, they weren't just limited to what they could type. We could always pick up the phone. They could always come in. But the ability to self-serve after working a hard day, and then mom has to cook dinner, and then get the house settled. I believe, as you may or may not know, women pretty much run healthcare in the United States. Right? They may not be all the physicians, but women pick the doctors for themselves, for their husbands, and for their kids. They are usually the frontline person for the in-laws. So whatever we could do to make their lives easier makes the most sense. One of the things we now are involved with is putting iPads. We have iPads in our exam rooms. My kids know how insanely protective I am of my electronic toys. So you can just imagine what it was like when I said, we're just going to put iPads in the exam room and see what happens. And so we've got them in nice little enclosures that keep them relatively safe, I think, and the patients are very respectful. But the point is to push information out to the patients, make it transparent, engage them. Because the new paradigm, again, is not the urgent care. The new paradigm is help patients help themselves. You can take care of more people that way. If they have information, they're empowered. We're all patients anyway, so don't we want as much information as we can absorb and handle to improve our care? So with these cute little devices, you see one on the table to my left, essentially we've got them again set up in the exam rooms, and when my medical assistant brings the patient back, we introduce them to the box. We say box, patient, box. And there's some quick keys, so you can click on, I usually use the Medline Plus, because I know that works 99.9% of the time. It boots up real quick. And we say, okay, what are you waiting for? High blood pressure? Type in high blood pressure, up, boom. And from there, they have access to articles that they can read, again, on this iPad. They even have a video. The DOH was nice enough to provide me with Sony headphones. Pretty nice, right? So the patients can listen to stuff, watch a video. Yeah, Brian is saying, they got headphones? Yeah, we got headphones. We got the 52-inch plasma screens that you guys provided now. No, they're 60-inch. They're not. Because as you know, sometimes patients have to wait more than 90 seconds for you to get into that waiting room, right? And you laugh. It could be 95 seconds sometimes. But, so while they're killing time, and most of them are playing with their handheld computers, but it's also useful if they look up stuff. Believe it or not, it makes for a more engaging conversation with the patient. I want my patients to ask me questions, believe it or not. It helps me help them. I need to know what they understand and what they don't understand. It's the question marks that hang everybody up. Some of you may know that I'm with the NOMIC, which is a medical liability insurance company, and one of the main reasons why there is a bad outcome, which can lead to litigation, is because there's an inadequate communication. Patient caregiver did not really understand what was going on. So whatever tools we have to improve that makes a difference. They could even log into that patient portal from my waiting room, and we've had patients do that. So while they're waiting, they log into the patient portal, and if they didn't get a chance to review those labs, which I said I push out every time I review them, they're reviewing them right there. And I had a patient not too long ago that we had started on medication, and there was a change in one of her lab results, and she's the one that felt that there could have been a correlation between the two, because she went through her lab results on the portal and said, you know, when I started medication A, this lab result started to change, and it was moving in this direction, and it's been 4 months, and what do you think? And I thought, wow, that's really good. Isn't it great to have people help you? You know, I mean, when you're in practice, you're kind of working in a silo. When you're lucky enough, you have Dr. Raj to give you a hand, but it's nice to have patients engaged with you. So I said, you know what, let's try it. Let's see if there's a correlation. We stopped the medication, looked at the labs, and no, she wasn't right. But she could have been, right? She could have been right. And that's the important thing. We can't see it all, right? The more we have help taking care of patients, the better it is for all of us. Transparency. From the very beginning, my wife has been buying reams and reams of printer paper because for the past 8 years, we've gone through about 4,000 oak trees, because at the end of each visit, we always gave out the office visit. Full 2 pages of office visit, subjective, objective, assessment, and plan. Their words about why they're here, what I found when I examined them, what I think their problem is, and what I think I can do for them. Every patient gets this at the end of each visit. Now, we really don't have to do as much of that because we can push a lot of this to the portal, and we do, but they don't get the full note, so I give them the full note, because when they go see Dr. Lessing, and Dr. Lessing says, well, why are you here today? And he says, well, I think I got something in my urine, and Volpe got a little frantic, and, well, Dr. Lessing might say, well, did you bring your note? And hopefully, the patient will say yes. And so, in my 2-page note, I have the whole history. Why the patient came in to see me, what were the significant review of symptoms, history of present illness, my assessment, my plan, and even maybe some lab results, so that I gave Dr. Lessing a head start on how to take care of this patient. So, again, by doing that, we work a little bit more efficiently. The world has moved on, as Stephen King would say. The world has moved on from solo practices, small practices, silos. We need to be interacting. So we have to interact with patients, we have to interact with each other. And New York City Reach, God bless them, and PCIP are helping us do that. They are a resource that I didn't have 10 years ago, but are here and are helping us now. They're helping us plug into Health Information Exchange, so that if I have to send something to Dr. Syed, I can do it in a secure fashion. Not just faxing, but sending her information that then plugs into her electronic health record, so she doesn't have to type it all out. And it makes more sense for her to be talking to the patient. If you hear missiles coming, you've got 30 seconds to evacuate the building. She can spend more time with the patient, because patients, another common complaint, part of that communication issue is doctors don't spend enough time, because we're busy trying to do pre-certification for this and trying to get a medication covered, which has always been covered, but now because of a new contract, they only cover a 500 milligram dose, not the 750 dose. It's insane. So whatever can make us more efficient makes us spend more time with the patient, improves quality of the care, and a quality of relationship. You know, I've stayed in this for 23 years. Many of you are my seniors, but not by much. But I think we've all stayed in it because we really love what we do. I'm sure many of us have had opportunities to do something else. And even though things have gotten tougher and harder for us, we'll doctors, we do it because we love taking care of patients. We love what we do, and we've got supportive families that let us do this. So all I can say is now we've got Big Brother, which used to be a derogatory term. You know, when the DOH would be calling you, that would be a scary thing, right? Just like when iPro would call, that'd be a scary thing. But now when you get a call from the DOH, welcome, because they're the people who are going to help us move into this current century and improve healthcare for all. So I think we're going to give some recognition to TCMS and meaningful use achievers. And then I encourage you to register for New York City Reach if you haven't already done so. We've got some registration tables. Please sign up for New York City Reach. It's the only way to take advantage of their programs. Thank you very much.
Recognize the other meaningful users in the room. Now, almost 70 providers across Staten Island achieved meaningful use in the last 2 years, and we're incredibly excited for this. So I'd like to invite representatives from some of these practices up that are with us this morning to get a certificate and a pin from us for your providers and to get a photo taken with the account representative from our organization that worked with you. So first, I'd like to invite Usha Thomas. Is Dr. Thomas? No. Oh, Dr. Thomas, you just came in. Please. We're very excited that Amboy Medical Practice, many of the providers at Amboy Medical achieved meaningful use as well. Is Dr. Kude available? We're also very pleased Dr. Vijaya Candidate. Also, a few of the providers from Richmond Internal Medicine Group is Dr. Hannah, Dr. Chacon, Dr. Brony available this morning. Moving on, the doctors Moretti and Rocco Associates. And if Catherine Paradiso from Staten Island Physician Practice, nearly 24 providers in our program achieved meaningful use in Staten Island Physician Practice already.
It's a very large stack.
And finally, from Island Internist, Margaret Marcino. Is Margaret here? And just to confirm I didn't miss anyone else, did anyone else in the room achieve meaningful use that I did not recognize? Well, we have pins for you, please. So we're also very excited about Staten Island Physician Practice is also a patient-centered medical home recognized level 3 practice here in Staten Island. Now, for those of you who are in the process of adopting electronic health record or have an EHR, interested in meaningful use or patient-centered medical home and aren't in the Regional Extension Center, our program is free. There is no cost for it. It's subsidized through the federal government and through some state grants and some foundation grants that we have. For those of you who are interested in becoming a part of our program, out of curiosity, who here is a member of NYC Reach? Any of the folks in the room? For those of you who are interested in becoming a member of the Regional Extension Center, Jess in the corner here is the rec services table. She can walk you through what our services are. You can join the program today for free. It's a small agreement, just saying that we'll help you in the achievement of meaningful use. We'll walk you through what the program is if you're in the adoption phases, or if you already have an EHR and you're looking to achieve some of the recognition programs that exist. For those of you who are interested in achieving meaningful use and want to get some more details on exactly what meaningful use is all about, Grace here will be able to help you with that, answer your questions about the program, eligibility, what are the steps that are necessary, and has some information, some education material at her table as well to walk you through that. For those of you who've already achieved meaningful use, some of the folks who are recognized in the room today, and who achieved meaningful use in 2012, like Dr. Volpe, you are now ready for stage 2 of meaningful use, which has a higher degree of achievement required in order to be recognized. We're very fortunate we have a table Ava is hosting here to answer your questions about stage 2, what to expect for those of you who are in the process of going through meaningful use. Maybe you already achieved 1 year of it, but you did it in 2013. You can start getting a sense of what's going to be required in 2015 for all of you. And then lastly, for those of you who are engaging in this transition and are still on paper records, Tori in the back can walk you through vendor selection, how to know which vendor is right for you, what sort of questions to ask, and she can help you with that. And I'm curious, in the room here, who's still using paper? No, don't be shy. Terrific. All right, so Tori will be able to walk you through any preliminary questions you have if you're still in the selection process, looking to get more information. And then for everyone in the room, we're very fortunate that at the corner table, Marie, Pat, and Ahmad will be stationed there answering any questions you have about billing and coding and any of the other incentive programs that exist, both with private payers as well as Medicaid managed care, as well as through Medicaid and Medicare beyond meaningful use, other programs that exist like PQRS, and we'll answer those questions for you today, and they'll be right there in the table in the corner. Now, additionally, we're joined from by some of our colleagues at some of the vendors who are really crucial in the adoption of electronic health records and the use of electronic health records, and that includes our EHR vendors. In the far corner, we have NextGen with us, Jim Taylor from NextGen. In the middle, we have our colleagues from Office Practicum. They'll answer any questions you have for Office Practicum. And in the middle, our colleagues at Aprima. If you have any questions about Aprima, they can certainly walk you through some of the information there. And then additionally, we're also joined by 2 clearinghouses. Now, if you're not familiar with a clearinghouse is really essential in the use of electronic health records as it helps you process your claims with the various insurance companies. They're able to scrub, to some degree, some of your claims, help you better track financially what's going on in your office, where you might have issues or rejections. And many of the clearinghouses are rolling out a variety of initiatives in order to provide a higher degree of support and to be able to help through a number of the new programs that are out there. So we're joined by our colleagues at MDON and at Gateway in the corner. If you have any questions about what exactly a clearinghouse is, or if you're a user of MDON or Gateway and want to get information about some of the added layers of support that they're able to offer today, they are available in the corner and can offer that support and advice to you as well. We host billing and coding classes actually in partnership with the clearinghouses because they've really developed some fantastic analytic tools. So when you're sitting there trying to figure out why you're not getting paid on claims, you can actually pull up in their system pretty easily and see what some of the issues are. And we do host co-trainings with them as well as our own independent trainings. And Pat, Marie, and I can certainly walk you through those trainings as well. So we're going to break now for about half an hour, give you a chance to finish your breakfast, to come up to our tables and to go to the vendors and get your questions asked. And at 9 o'clock, we'll conclude our program with a few closing words. But again, I cannot thank all of you enough for taking the time this morning to join us. Certainly, if you have any questions, anyone you see standing around the perimeter here is available to answer them. And of course, I'm available to answer them as well. So thank you.